We have Dr. Moumi Bakare, consultant, public health physician and lecturer, National Professional Officer for Malaria World Health Organization. That's Dr. Tolu Arolo, who will also join us in the studio. But Dr. Bakare is here. Many thanks for your time on TVC Breakfast this morning. Really, quite a number of figures that might be mind-boggling. About 60%. 300,000 people infected, and Nigeria isn't doing so well in this particular category.
Well, thank you very much for inviting me. Malaria is a deadly disease, like the statistics have shown. But at the same time, where the government is doing well, the people also need to do more. But despite the statistics, even the statistics, we realize it's just the tip of the iceberg. There are so many cases in the communities that are not reported. But we can't really say government has not done much. We have done. That's why the team for this year is End Malaria Now, because there has been a series of programs, strategies put in place that have been implemented, and these have really gone a long way to even reduce the statistics. So what we need is to sustain what has been commenced all over the years.
Okay, now there has been several strategies, so many campaigns by international partners, governments at all levels, local governments, state governments and all. How impactful or effective has all of that been if we have to pitch it against how much of malaria incidences have gone down?
We can say it has been quite impactful with the collaboration of all partners, because there is a World Malaria program partnership that is headed by WHO, and this has really done a lot in terms of mobilizing even the community members, because you find that treating malaria is an environmental problem. So it's in us to ensure that our environment is clean. Even if we have all the drugs in the hospitals, doctors are trained to manage malaria, but how about environment? Because the mosquitoes that carries the parasite breathes in the environment. So in terms of dirty environment, that still goes a long way. So the community, the people has a lot to do to ensure that even if we have some gains, we need to sustain those gains. And that's by ensuring that all the strategies which are ensuring that there is early diagnosis and treatment. Because when you have fever, you need to go to the necessary hospital to take some tests and make a correct diagnosis, and we are giving the appropriate treatment. Having done that, you also need to start preventing it. You don't just want to go to the hospital treating malaria every time. You want to prevent malaria, and there are a lot of strategies to prevent malaria. You can sleep inside the net, which is very good, but people complain because the weather is hot. But will you rather have fever from malaria and die from malaria, or having the inconvenience of the hot net? You can also ensure that your environment is very clean, your drainages are cleared, and that can go a long way in reducing the burden of malaria in our communities.
Really, just while you were speaking, I was just wondering, do you think Nigerians don't know this? An average Nigerian, I think, knows what you're talking about. So what is the issue? Why are they not living by these rules?
Well, behavioral change is the most difficult things for people. So we need to continue to sustain the messages we pass along. If you go, like malaria is here with us, so you can't just go to the community and do a program and that will be the end. You need to engage the people. You want to mobilize people to take up the program. Like you have the community structure, CDA, CDCs, they should continuously talk about malaria, maybe during their monthly meetings, environmental sanitation, continuously talk about malaria, so that at the end of the day, it's even the child on the street will be able to know that your environment is the way to prevent malaria, a clean environment. So it's that we need to continuously ensure that the message is in the public domain. Environment is key. Make sure your environment is clean, and that's very important.
All right, let's just take a story here. Every year, the World Health Organization and its partners unite around the common World Malaria Day theme. Its aim is to dramatically lower the global malaria burden over the next 15 years.
Now, this year's theme, End Malaria for Good, reflects the vision of a malaria-free world with a timeline of 2016 to 2030. Now, this timeline is aligned with the 2030 Agenda for Sustainable Development. Now, the new Global Development Framework endorsed by all UN member states. WHO's goals, though ambitious, are attainable, and they are reducing the rate of new malaria cases by at least 90%. Another is reducing malaria death rates by at least 90%, eliminating malaria in at least 35 countries. Now, preventing resurgence of malaria in all countries that are malaria-free. And malaria is the third leading cause of death for children under 5 years worldwide after pneumonia and diarrhea diseases. Now, about 3.2 billion people, almost half of the world's population, are at risk of disease.
In 2015, 97 countries had ongoing malaria transmission. 80% of estimated malaria cases occur in 15 most affected countries. 35% of malaria deaths occur in just Nigeria and the Democratic Republic of the Congo. Statistics from the World Health Organization shows that 2014, that's 214 million cases is recorded globally. 4,338,000 deaths recorded globally. That's 90% of deaths occur in sub-Saharan Africa. 70% of deaths are children under 5, like we told you earlier. About 3.5 billion people, almost half of the world's population, are at risk of malaria. 35% of malaria deaths occur in just 2 countries, Nigeria and the DRC.
Now, 30 countries in sub-Saharan Africa account for 90% of global malaria deaths. Nigeria, the Democratic Republic of Congo, Ethiopia and Uganda account for nearly 50% of global deaths. And malaria is the second leading cause of death from infectious diseases in Africa after HIV/AIDS. Now, almost 1 out of 5 deaths of children under 5 in Africa is due to malaria. Now, in Nigeria, malaria is responsible for 60% of outpatient visits to health facilities, 30% of childhood deaths, and 25% of deaths in children under 1 year. Now, it accounts for more cases and deaths than any other country in the world. Now, malaria is a risk for 97% of Nigeria's 170 million population. And the remaining 3% of the population live in the malaria-free highlands. And there are an estimated 100 million malaria cases with over 300,000 deaths per year in Nigeria. Now, let me come to you, Dr. Bakari. A likely time frame has been fixed, 2016 to 2030, to be able to eradicate malaria. How attainable, considering the societal indices and health indices on the ground, how attainable is that?
Well, like I said earlier, it's attainable. It's in line with the Sustainable Development Goals. These are 15 years. And it boils down to all stakeholders working together and have a roadmap. We should have a roadmap, and every stakeholder, all the governments, local, states, and the federal key into this. Of course, it's definitely attainable. But at the same time, like I said earlier, the communities must be carried along. You can only do with the people. If you do for them, it's not sustainable. If you carry them with the Sustainable Development Goals, all the strategies are put together, and then every stakeholder has their own roadmap. Then I think we can say at the end of 2030, Nigeria, at least we should be able to say malaria should be out of Nigeria.
Okay, we have joining us now Dr. Tolu Arowolo. You're here with us in the studio. Many thanks for all your time on TV's Breakfast this morning. But we'll still direct our question to Dr. Bakari here. Let's take a look at the issue of fake drug in Nigeria the treatment.
But before we go there,
time for news, really.
It's time for news updates now. Yeah, and Kemi standing by. Kemi, good morning again.
Thanks, guys. Well, Nigerian troops ambushed and killed 5 suspected Boko Haram terrorists escaping from Sambisa Forest to Fulawani village on Sunday. Acting Director, Army Public Relations, Colonel Sani Usman, said in a statement that the fleeing terrorists were crossed by the troops while trying to link up with other terrorists or members of their families to relocate to other places. While the heat on Senate President Bukola Saraki to resign gets hotter hours after penning what he termed persecution by some APC leaders, a group, the Nigerians in the Diaspora Monitoring Group, is offering to help him write an appropriate resignation letter if he doesn't quit immediately. They say Saraki, in addition to the many charges against him, has endlessly abused the judicial system. The group says Nigerians are now the butt of online jokes that say the only court Saraki hasn't approached to stop his trial is the basketball court. The 3 officials of the Osun State government kidnapped on Friday have regained their freedom. Head of Service Olayinka Oweye in a statement said the 3 civil servants were freed on Sunday evening but didn't state if ransom was paid. The Permanent Secretary of Osun State Ministry of Finance, Adebinkpe Ogunlumade, Director of State Audit, Tajuddin Badejoku, and their driver, Oladakbo Arogundade, were abducted by some unknown gunmen along Obajano Lokoja Expressway in Kogi State when they were returning from Abuja. The All Progressives Congress emerged winner of the Yobe National Assembly by-election held on Saturday across 4 council areas of the state. The polls were conducted to fill the space left by the current Minister of State for Foreign Affairs, Khadija Bukar Abba. Declaring the results, returning officer of the election, Professor Sunday Alao, said the APC candidate Abdullahi Usman Kuku has scored the highest vote to defeat his closest rival, Nasiru Hassan Yusuf of the People's Democratic Party. But the People's Democratic Party won all the 18 chairmanship positions in the local government elections, this time in Ondo State. The party also won 202 councillorship seats out of the 203 seats available. The Allied Congress Party of Nigeria won only 1 councillorship seat in the election, boycotted by the main opposition party in the state, the All Progressives Congress. The APC faulted the election, describing it as a sham. And that's TVC News Update at this time. The conversation on World Malaria Day continues now.
Right. Kemi, for the updates there.
Okay. Just before we had the news, the question was on the issue of fake drugs in Nigeria, and Dr. Bakare is here, and of course Dr. Arolo of the WHO is also here. So the question goes to you, Dr. Bakare, before Dr. Arolo answers.
Well, of course, the issue of fake drugs, we still have them in Nigeria, and then we cannot rule out the fact that the people still go to the community, the nearest centers, nearest shops to get their drugs. So what we can ensure is that we have an organization that is responsible for bringing genuine drugs to the country. So the government needs to strengthen that organization so that those drugs that are imported are genuine and are good and awesome for the people to consume. Because some people may not, maybe the health centers are not very close to where they live. They go to the nearest shops, and if those shops stock fake drugs, we need to ensure that they are mop up. There should be some monetary teams, either from the local government or the state government, which I know they are available. So they need to up their ante and make sure that these things are done very well. People are not exposed, because the consequence of fake drugs even be worse than that of malaria that they are trying to treat. So it's very essential that task force should be on ground. Even the communities can police themselves in regards to fake drugs, so that people are engaged. When you educate the people, they tend to take their health into their hands. The opinion leaders, they can go into various shops and request for what are these things? How can we identify, differentiate between fake and genuine drugs? So the government may not be able to do everything. They may not have the human resource to go around. But if you engage the people, partner with them, teach them on how to identify fake drugs. If somebody has malaria and he has to visit a health store to get drugs, we should be able to identify that. I know there are some ways that people can now scratch. I know those ones that are fake and those ones that are genuine. So it's still a lot of the relevant stakeholders doing the right things at the right time.
Okay, let me bring Dr. Tolu Arolo in here. I'm going to ask you the same question I asked Dr. Bakari earlier on. Now, you are with the WHO, and WHO has been partnering countries. Now, we are narrowing it down to Nigeria. WHO has been here doing so many grassroots campaigns, so much strategy, partnerships, and all of that. How much of impact has all of that had in bringing down malaria?
Thank you. Good morning. You've asked a question about impact, and that's what researchers always want to see at the end of the day. We've done so much, but how far have we gone? Yeah. And you are right that WHO has been working with a lot of partners in Nigeria, especially the National Malaria Elimination Programs, along with the states. We've done quite a lot in all the thematic areas of malaria prevention, malaria treatment, and surveillance, because it's not just enough to prevent and you treat. You still need to go ahead and do surveillance to know where you are in the efforts. We are sure that we're making progress. It's rather slow, but we know the kind of terrain we are working in terms of the population, in terms of the seeking behavior of the people, in terms of our environment, which of course we know is very good for the breeding of mosquitoes, and in terms of the community that we're working in. But recently, over the past from 2000 to 2015, we've had close to about 20% reduction in malaria parasitemia. I'll break that down. What it means is that when you get a lot of people and you take their blood smear, when you look at the blood smear under the microscope, you will check if the blood smear have parasites. We found that in those people, we've had about 20% reduction in the number of people who carry these parasites. That to us as scientists is a good goal, believing that it is when people have the parasite in their bloodstream that mosquitoes can pick it, and of course we affect another persons. But in terms of the community participation, behavioral change among the people, we are still far from achieving that. People are not using this net that we are giving to them. A lot of pregnant women are not accessing health care at the government designated health facilities. We are sure that you can get quality services. We are also aware that a lot of people are patronizing vendors, buying all kinds of drugs, even using local herbs, which we are not even sure can cure malaria. And all these practices are slowing us down. And of course, we're doing a lot of campaigns among the people, ensuring that they change this behavior such that we can be able to achieve more. And until we begin to do that, the impact will be very slow. But I tell you, we are moving along the line, and we believe we'll get there.
Let's talk about the campaigns. Is it possible that some of those campaigns are too elitist for the people in the rural areas, that they don't understand? One, now tie that to the issue of mosquito nets, treated mosquito nets, allegations of those nets being sold. Because if the people know that these nets are free, why would they pay for it?
You asked two questions, actually. Number one is the kind of campaigns we're doing, are we tailoring it to the understanding of the people? I tell you, we're doing that. Our campaigns is such that it is strategic. When we're going to the community, we break it down straight to the community, and we make sure it's in the language they can understand. We even use things like education, entertainment, and we work with the people in the grassroots. It's not only the WHO that will go out. You will work with the CDAs, you work with the civil society organization, using the language the community can understand. I believe the community actually understands this. It's just that for them to begin to practice all this, to bring out the behavioral change we want and to bring out the impact we want in malaria control, we are yet to see this. But we'll keep on doing it, because until people begin to clean their environment, until they begin to use malaria prevention techniques that we're teaching them, then malaria will continue to be with us.
Okay, Dr. Bakari, the fight to end malaria, a time frame has been fixed. Are we also seeing the possibility of ending or not seeing mosquitoes again? Because mosquitoes are the carriers of malaria. Is that what it means, or the implications?
No, not really. Like we said earlier, it's an environmental issue. Even this date that has been set, we also need to, not just the environment, like the behavioral change that we talk about. Mosquitoes will always be in a unclean environment. The way we handle our environment, that's what we'll get. So it is very important that there are some strategies that should be followed. Apart from the behavioral change communication that we are preaching, also the use of the net, of course, is one that the people must key into, use regularly and consistently. Because if you claim you use mosquito nets and you only sleep inside the net once a week, definitely the mosquitoes will still be there in your community, in your room, to bite you when you don't use it. So you need to ensure that you use the net consistently. You also need to ensure that the drainage in your environment is clean. You can also do, communities can come together, can do some, we have the indoor residual spraying, they can spray the indwellings of their rooms, and then that one can last for about 4 or 5 years. And that one will go a long way to reduce the mosquito body in the environment, which of course eventually will reduce the malaria body. We also want to encourage our people to increase their health-seeking behavior. Go to the facilities where doctors have been trained. The government has invested a lot in training human resource on malaria. And if you don't assess it, then what happens? They go to the vendors in the community, and that's where we have the issue of counterfeit, fake drugs. And when they use that, there's resistance, and on the long run, you spend more, and the cycle goes on, the complications. So we need to ensure to continuously provide relevant information for the people, for them to use the information to better their life.
Okay. Now, I'd like to invite Wale now. Wale Fakile, he will give us the reaction of what the people are saying as far as...
World Malaria Day, yeah.
Yes.
Quite a lot of reactions. So we just go to the barcode straight and see what people are saying as to malaria. So that's a picture of a mosquito on his skin. And move on to this comment from Dr. Ibrahim, who says, malaria kills, but it's preventable. Half of the whole world is at risk. It's endemic in Nigeria. Let's hashtag defeat malaria. It's World Malaria Day. And for Erico, do you know that Nigeria currently holds the largest share of the world's burden of malaria? Hashtag end malaria for good. And the next comment comes from Malaria Program Nigeria that says, malaria has remained a public health problem in Nigeria. Children under age 5 and pregnant women are the most affected. Hashtag end malaria for good. And for Elegbede Tayo, JET, from the rural to urban spaces, malaria is still a common phenomenon in Nigeria. We need education, empowerment, and healthcare to eradicate malaria rather. And the Health Zone says, of the 2014, 240 million clinical cases of hashtag malaria that occurred globally, Nigeria accounts for over 40% of the total hashtag malaria deaths globally. And for the 7 God, it's funny how whenever you feel even slightly ill in Nigeria, everyone rushes to give you malaria drugs. That's how common malaria is in Nigeria. And for A. Putin, in Nigeria, people die of malaria every day, yet we import mosquito nets. For we claim giants of Africa, hashtag shame. So those were some of the reactions. Now, I want to know from doctors. I was reading a report, and it says that the reason we're having this a bit of a slowdown in countering or stopping malaria in Nigeria is because funding. Authorities have begun to cut down funding. I want to know, is that actually the scenario that is playing out now? That's for Dr. Bakari.
Well, what is happening in regards to funding health issues, services, is cut across all. But it's not as if it's supposed for airports to look inwards, to prioritize what we need to, because malaria is with us and is a great body in Nigeria. We need to prioritize and ensure that we address this, because it kills the children and it also affects the pregnant women. So, of course, funding is dwindling, but at the same time, we need to reprioritize. Though support still come from time to time, but of course the government, the local, state and the federal can also use the relevant budget to support whatever the partners are also giving us.
Fantastic. So I want to see doctors after the program because I think I have a bit of a slight malaria.
I think if we don't take this issue seriously,
the issue of funding is very important.
Yes, the issue of funding is very,
very
Wale
important.
took that question out of my mind because I know, for instance,
prepare for injections.
yes,
Yes,
I know that Gavi and some other are withdrawing their funds as we speak.
Really, that brings us to ourselves.
Yes.
We don't have to keep on waiting for the international communities to solve our own problems for us. Now, if funding is going down at international level, that means domestic funding should rise up. Beyond domestic funding, looking at our governments, communities should begin to rise up because it is our disease. Let me put it that way. And I've told you, if communities can come together, then we can achieve a rather fast impact for malaria control because malaria is in the community. It's like a triangle. You have the human beings, you have the mosquitoes, and you have the environment. And who can best solve that issue is the community. It's a community disease. So if funding is coming down at international level, then domestic funding should be able to come up to sustain all these interventions. Use of nets, and everybody can buy net on their own and use it to use the right drugs for malaria because malaria is curable. And now we have drugs that are very affordable, almost at the price of chloroquine. You've read about the affordable medicines for malaria. It has a logo on it. It's like olive leaf. And those drugs are quality assured. So if you go to the pharmacy and ask for an anti-malaria and it has this logo, you can be sure this is quality assured medicines.
All right, Dr. Tolu Arowolo, the National Professional Officer for Malaria World Health Organization, thank you for coming. And Dr. Omomi Bakari, thank you very much for coming.
Can I say something with regards to NGOs, non-governmental organization?
Just 2 seconds.
Yes.